Hello, today we have Dr. Anmol Mehra with us, a leading laparoscopic surgeon, an obstetrician, and a gynecologist in Mulund. Over to you, doctor.
Hi Neha, nice to meet you. It's a pleasure to be here today, and looking forward to having a conversation and discussing general health issues, especially fertility related women's issues, so we can clarify some myths and dispel some lesser known facts. We can also impart knowledge regarding some certain lesser known facts.
For sure.
Today.
All right, so I'll begin with my question.
Sure.
So, the first question that I have for you is that when we talk about fertility issues, is it something that only people in their 30s and 40s should be concerned about, or do you think the younger generation, maybe the 20s, do they also need to be, worrying about their fertility health or their reproductive health?
Right. So the term midlife crisis is a fairly commonly used term. A lot of people do know about it. But the so-called fertility crisis usually starts slightly before the midlife crisis. Now, our lifestyle choices, our habits do have an effect on how fast or how slow it can affect our fertility. Now, it's a myth that fertility issues only arise in people in their 35s and 40s. Yes, with age, there is a decline in fertility, but it's not that only people in their ages of 35 or 40 and above experience such issues. Now, there are certain cases in which their medical disorders or their habits or environmental factors can cause people even in their late 20s to undergo these fertility issues. Now, just to name a few, what are they? First, there can be health-related issues. Health-related can be both physical and mental.
Right.
In women, health-related issues can be fibroids, endometriosis, PCOD, whereas for men, it can be hernia, hydrocele, or infection in the pelvic area, etc. It can also be certain environmental factors, like if suppose there is exposure to radiation or chronic pollution. Besides that, there are certain lifestyle factors as well. Both include professional and personal. In personal factors, there is stress, then there is diet. There are certain habits like smoking or alcohol. And in professional, now suppose if you're working in a very hot environment or you're working in a radiotherapy center where there is exposure to radiation, these are also factors which can affect the fertility. Besides that, also STDs. If the male or the female partner is suffering from any sexually transmitted diseases, that can also affect fertility. So in short, basically, if you are someone who's interested in parenthood, you should visit your fertility specialist, get a basic checkup done, which evaluates your baseline level, and it will give you an idea regarding where you stand and what challenges, if any, you will face going forward. It could even be simple things like thyroid or diabetes. Or if you're planning to conceive at a later point, it lays out a roadmap for you so that you are aware of what challenges are there going ahead.
Right. So I think fertility issues is not restricted only to people in their 30s.
No, not at all.
It can happen earlier as well.
Absolutely. Yeah.
Doctor, what could be some signs or symptoms, as a person, for me that, okay, now I need to go visit my gynac, or these are some issues that need to be discussed?
Right. So, to visit your gynac, we would say that to all the ladies out there, I would request, please don't visit your gynac only when you have missed a period or if you have irregular menses. A gynac checkup should be a part of a regular, thorough checkup and examination. Ideally, it should be done on a yearly basis. Now, there can be advantages of both physical and mental advantages when you visit a gynac. When physical issues include, now it helps you catch a certain disease earlier rather than when it becomes a bigger issue later on down the line. When you visit a gynac, he or she will, of course, do a physical examination, a pelvic examination, or breast examination, or maybe pap smears, ultrasound, whatever is necessary to assess the health of the person at that given point of time. But the mental aspect also includes the woman can easily discuss what issues she's having at that moment of time, can get counseled by the doctor, and can openly discuss what issues they are facing and what are the solutions going ahead. This counseling is extremely important. It also helps to relieve the stress or dispel any issues or myths surrounding this disease or whatever issues the lady may be facing, which helps to ensure that going ahead, whatever disease it may be there does not blow up into a much bigger issue. We have to remember the one important dictum: prevention is always better than cure. Hence, do visit the gynac. on a regular basis, maybe yearly basis.
Right. So there is no specific symptom that I need to wait for to visit my gynaec.
Absolutely not.
All right. So, doctor, stress seems to be a very common part of most of our lives. There is work deadlines, there are assignments for students, submissions, a lot happening. So, do you think stress can affect fertility in any way?
So when you say stress, what sort of stress do you mean? Mental stress?
Yeah, like the whole emotional exhaustion, mental stress, the pressure, the deadlines.
Right. So, I mean, stress can not only be mental, but of course, that mental stress then trickles down, becomes physical stress, also affects your body, hormones, etc.,
Right.
which can have a detrimental effect on your entire body. And of course, that also affects your fertility. The most important thing is chronic stress has an adverse effect on your HPA axis, which is your hypothalamic, pituitary, adrenal axis,
Okay.
and which disrupts your hormonal cycles and causes problems throughout the body. Now, this can be physical, it can be mental, it can be hormonal. Now, hormonal, to break it down, for males, of course, it can cause decrease in the sperm count, decrease in the sperm motility. It can also cause damage to the sperm DNA. For females, it can decrease the ovarian reserve. It can reduce the ovum quality and, of course, damage the ova DNA and also cause hormonal imbalance leading to menstrual disturbances, etc. So the hormonal aspect. Coming to the physical aspect, in males, it can cause erectile dysfunction. For females, stress can also lead to, or even in males, of course, can lead to diet disorders, can lead to chronic depression, etc. And of course, it also stress affects you mentally to such a degree that it disrupts each and every aspect of your life. You're unable to function properly.
Right.
So hence, chronic stress disturbing your HPA axis has an effect from head to toe. So what can we do to counter it? Most important things being mindful, meditation. This is one of the most important things. Seems very simple, but to actually get it into practice, it's extremely difficult and you need to work on it. Secondly, exercise and yoga. And thirdly, counseling. It helps to such a great extent to understand what you're going through, to share it with someone and not to burden yourself with it throughout. So basically, stress has to be managed. It is a part of life. We have to accept it.
Right.
But acknowledging it and managing it is a crucial thing in today's day and age in order to maintain your own health. Not only mental, but also physical.
Right. So the mind and body connection is real.
True.
All right. So, doctor, there's an ongoing trend currently. I'm not sure if you've heard it. It's called DINKS, dual income, no kids. So, people are waiting to be financially sufficient before they have kids, and some of them are planning to not have kids at all.
Sure.
So, do you think there's a certain age which would be considered too late to have children?
Okay, so when it comes to fertility, Mother Nature does have a limited window of opportunity.
Okay.
Now, of course, there are modern medical marvels which do help us extend this window of opportunity for the women to conceive or for the couple to conceive. This includes both medication and procedures. Now, these are medications which enhance the fertility for both male partner as well as for the female partner, and procedures like IVF, ICSI, etc., which also help the couple achieve pregnancy at a later point in life. So nowadays, we regularly see people, even in their 40s, getting pregnant thanks to all these procedures. But most importantly, we have to know that along with late pregnancies comes certain risk factors, be it both maternal or fetal, or simple, like just difficulty to conceive at a later age as fertility reduces. So keeping all these factors in mind, age-related factors for the lady, which includes hypertension, diabetes, etc., at a later stage in her life, and fetal complications, like maybe can be higher chances of fetal abnormalities. So keeping all of these factors in mind, it is important to take a decision regarding having children at your own level, but be informed about all the pros and the cons of it.
Right.
We are no one to sit here and to judge, because having a child is a very personal decision. It's a very valid decision, and there is not one approach which fits everyone.
Correct.
So no judgment from us at all. But of course, we have to educate the patients regarding the pros and the cons of the same.
All right. So as such, there is no specific number that can stop you. But then with age, like you said, there are other risk factors that come in.
Yes, absolutely. So being aware makes a big difference, so that when you do plan, you know what could be the challenges going ahead.
Right. So when we talk about pregnancies in the later stage of life, is there any challenging case that you've experienced?
Yeah, recently we had a couple. Both of them were in their 40s, and the lady was almost on the verge of menopause. We would not say menopause. And she was around 43, 44 years of age. And she had already conceived earlier in life, and she had a LSCS, but she was having secondary infertility, unable to conceive. So in this case, it was again a very tailor-made approach because specific to the patient. And in this case, we did PRP therapy for the patient. And after injecting the plasma, then we started the entire IVF and ICSI protocol for her. And miraculously, I would say happily for them, they conceived in the first shot of IVF with ICSI, of course. And of course, now she is around 7 to 8 months pregnant, stays very close to the hospital. And now, hopefully she'll have a successful pregnancy outcome in the next 2 to 3 months.
All right. So she was pretty close to menopause, not there yet, and she could get pregnant.
Yeah.
Okay. That tells us a lot about the scientific advancements that we have for fertility. So, Doctor, I've heard of a lot of fertility tracking apps and also devices that you can wear.
True.
But how reliable are these devices? I mean, can an external device really find out what's happening inside my body?
That's such a good question, to be honest. Of course, nowadays, fertility tracking apps or devices have become ubiquitous. Everywhere you can see it. You can see people wearing it. But the most important question is, are they really that effective or just glorified calendars? So in our opinion, yes, they are important. They do help women or men, of course, keep a track of their fertility. Especially women can record their menstrual cycles, the day and the dates, and also keep a track of any other fertility issues that they have faced, like infections, through these apps. But if you want a deeper assessment of your entire fertility, then you have to visit a fertility expert, because these apps, they do help to a certain extent, but they will not dive deep into the fertility tracking. So they do help you to keep a track, which you can, of course, turn it over to your gynecologist as well to help him or her decipher what exactly you have been experiencing for the past few months. And that does help because that gives them good and valid data and also helps you keep a track record. But for thorough fertility assessment, it is important that you visit a gynecologist. Then they will, of course, examine you. They will advise certain tests. And then they will come out with a fertility check or fertility score. And then they will put out an entire plan for you according to what you need at that given point of time.
Right. So we can't fully depend on these apps. We'll have to consult a specialist.
Yeah, exactly. So, of course, as I said, they help you track, they help you record, and they help you hand over the data to the expert. Right. That data can be used later on for fertility assessment. Going further.
So, Doctor, when we talk about egg freezing, that is something I've heard associated with celebrities a lot. Like celebrities tend to opt for it so that, they can achieve a certain level of success in their careers.
Right.
But I've not heard people who are not celebrities, like normal people, who opt for this a lot.
Right.
So, is this something that's only for the richer folks?
No, not at all. So, firstly, let's dispel this myth today that egg freezing is only for celebrities. It is absolutely not. It is a powerful tool which helps you, which empowers you to achieve parenthood even at a later stage in your life. And it is absolutely not only for celebrities. It can be for everyday folks. In fact, nowadays, egg freezing is affordable, it is accessible, and it is acceptable. These are the 3 A's. So even regular women, in fact, even day before yesterday, we had a lady who came up and she is in the middle of her career and she's a high flyer, high achiever. And she herself came up to us and asked for information regarding egg freezing, which we of course gave to her. So there can be a variety of reasons, which includes career-driven choices, which includes just a personal choice that they would like to opt in for a chance at pregnancy later. It can also be medical conditions like certain genetic conditions, which can also cause or drive a woman to undergo egg freezing. And of course, there can be certain environmental factors if a woman is working in probably a radiation-based environment or whatever. And hence, these are the factors which can cause egg freezing to be taken up as one of the options.
So, doctor, I've heard of egg freezing for women. Is there something for men? Can sperms be frozen?
Yes, of course. Women aren't the only ones who are hitting a pause on parenthood. Semen freezing is a game changer for men who want to achieve parenthood at a later point of life. Again, it also provides men with a flexibility going ahead. And in some cases, there may be a need to, freeze their sperms. I'll give you, of course, we'll, jot down some reasons, which could first be medical reasons. If the person is suffering from certain infections, like infection of the spermatic cord or infection in the pelvic area, or if the person is undergoing some physical symptoms, physical diseases like hernia or hydrocele, simple things, but these can cause a reduction in the sperm count. Or also there can be genetic disorders which the person may be facing. Besides that, it just may be a personal career-driven choice for the person to freeze the sperm at this point of time and then utilize it at a later point of time. So one of my friends chose to undergo sperm freezing because he had a spermatic cord infection bilaterally on both sides, because of which he had to undergo vasectomy. So before undergoing the vasectomy, he chose to freeze his sperms, and so that he can, of course, achieve parenthood, fatherhood at a later point of time in his life, which was a very sane decision according to me, and which did help him at achieve pregnancy once he did get married, and that gave him a shot which if he would not have had if he would not have chosen to undergo this procedure. So what exactly is sperm freezing? We call it cryopreservation. You collect the sperms, you analyze the sperms, you prepare, and you freeze the sperms in liquid nitrogen at 196 degrees. Later on in life, whenever you do want to use the sperm, you thaw them and then you use it for procedures. Now, the important point to note out here is it gives you a chance of success. But again, the chance of success will depend upon the quality and the amount of sperms which are there. And so we can easily achieve a success rate of around 50 to 60, 70% with frozen sperm at a later point. Again, the most important takeout is that we give the patient a chance, a shot at achieving fatherhood at a later point of life.
Right. I think freezing eggs is very common, like we've heard of it, but this is something new. I think I didn't know this before.
Yeah, it's less heard of, but it's very common in practice because men do come up, and of course they might be more shy in expressing this. But when they have to undergo it, it is important that we explain it to them, the pros, the cons, what they have to undergo. And once they understand it, they're perfectly fine to go ahead with it. So maybe it's less talked about, but it is very common in practice to undergo this procedure.
Right. And I noticed that you mentioned 196 degrees. You also mentioned that during egg freezing.
Right.
Any reason why this specific temperature?
So basically, it's the freezing temperature for liquid nitrogen.
Okay.
And that is the most important thing, which does help us freeze the egg or the sperm later on to obviously thaw it and use it. And at this temperature, we can ensure that the viability of the gamete, be it the egg or the sperm, remains, and we can use it later on again.
Okay. And is there any specific criteria that men need to meet before they, want to freeze their sperms?
Right. So again, a thorough examination has to be done. Now, a thorough examination would include a physical examination. It would include blood tests and hormonal tests. It would also include a sonography. So after undergoing a complete examination, a fertility score is decided and the men are advised accordingly. Now, suppose if they have a very severe sperm deficiency, then we can take multiple samples as well. So again, each case is tailor-made. Each case is an individualized case-to-case basis, and then we treat or advise accordingly.
Right. Are there any specific conditions where a person might not be able to go ahead with this?
Yeah, now suppose if a person has certain sexually transmitted diseases. So now in such cases, we do, of course, counsel them and we tell them that this may be the case. Or if suppose the patient has azoospermia, means the semen is there, but there are no sperm inside the semen. So
Okay.
that is another condition in which we wouldn't advise to go for semen freezing because there are no sperms in the semen. So certain conditions do exist. Of course, we can go into a lot more in theory, which I don't know whether we have time for it here or not. But yeah, when you visit a fertility specialist, he or she will, of course, guide you according to your individual case.
So, when we talk about babies and the Indian culture of baby showers and god bharai, as we call it, so is there any other thing associated with the coming of a baby, in terms of medicine, in terms of health, that we should be doing but we aren't doing?
Right. So, I mean, in India, of course, it's a very huge occasion, God Bharai and Baby Shah. In fact, to be very honest, one of our patients, who's a third generation patient, her mother delivered with us. Now she delivered with us. And now even her sister is in fact delivered with us. So she invited us recently for her Baby Shah. It was such a nice occasion, in fact, to meet such old patients. But anyway, coming back to the main question, yes, you need to prepare. So baby shower is one of the most important preparations, but along with that, I'll just divide it into what to do, what not to do, what to eat, what not to eat, and of course the important other things. So what to do is you have to do exercise and yoga at a specific point of pregnancy, of course, which will be guided to you by your obstetrician gynecologist. There are also certain Garbh Sanskar classes, which adopt a holistic approach towards pregnancy, and they encompass a lot of other points which help the woman deliver, which includes prenatal birthing exercises, etc. What not to do? Please don't take stress. Leave the stress to the doctor. You've come to the doctor. You need to relax and you need to be stress free because we don't want the stress affecting the mother or the baby. And what to eat? A balanced diet is extremely important. I'm not asking you to stop eating burgers or pizzas, but restricted quantity, of course, and a balanced diet gives you a huge advantage in delivering all the nutrients which are required by the body. Hydration, which is a simple thing but often forgotten. And of course, your prenatal vitamins, which include folic acid, B12, etc. And of course, regular visits to your gynecologist, obstetrician, who will guide you and advise you at what steps to take at what point of time. And most importantly, I would also say read, educate yourself as to what you will be stepping into, not only during the pregnancy, during labor, post-pregnancy as well. So these are important key things along with the baby shower. No one's stopping the baby shower, of course. And these are the things which are important and which should be kept in mind throughout the pregnancy as well. And it's our responsibility to guide you and to make sure that you are following the correct path and to catch any deviations from abnormality as early as possible.
Right. And you mentioned foods. So that brings me to pregnancy cravings. I think it's a very commonly heard thing. And I've heard that people crave a lot of fatty foods during that time.
Right.
Is there a specific reason why people like fatty foods during that time?
Everyone is different, to be very honest. My cousin, when she was pregnant, she craved Baskin Robbins mint choco chip ice cream. So my cousin used to go and, take her husband out, and like every week, once they used to have their ice cream, every woman would be different and every craving would be different. But that's fine. If you do have a craving, no one is stopping you. But of course, limited quantity and at the right time with the balanced diet and vitamins and of course, all the other things.
Is there any specific food or anything for that matter that should absolutely not be consumed during pregnancy?
So, of course, foods which can be harmful to the mother or to the baby. Some people say that if you have allergies to certain things, like suppose mushrooms or certain fungi, don't consume that. Or simple things like even in early pregnancy, people say don't have pineapple or papaya or something like that.
Yeah.
But of course, we do advise and we tell them that these are certain things which you should avoid. But as pregnancy progresses, we don't want to restrict completely. We just want to make sure that they are aware of the side effects or the pros and cons of it.
Right. Okay, so doctor, I had a relative who had a high-risk pregnancy, as her doctor told her. So I wanted to know whether something that she had done made it a high-risk pregnancy, or was it just that way genetically or due to some issue?
Okay, so a high-risk pregnancy can be because of a vast variety of factors. Now, some of these factors are maternal or mother due to the mother. Some of the factors are due to the baby, or some of the factors are pregnancy related itself, or maybe because of both the mother and the child. So now we'll just shortlist just a few. So first would be pre-existing conditions before the pregnancy, like diabetes, thyroid, obesity, or sometimes it can just be age, that the mother is either too young or the mother is too elderly in age. That itself is a high risk factor. Thirdly, it can be because of diseases which are developed during the pregnancy, like hypertension. So we call it, hypertension of pregnancy or diabetes of pregnancy, or sometimes even thyroid can exacerbate during pregnancy. So these are medical disorders which can occur. And besides that, there can also be a factor like multiple pregnancies, like more than one pregnancy, like twins or triplets. That itself is a high risk case. Besides that, also previous pregnancy outcomes, like if a lady has had multiple miscarriages in the past, or she's had a previous LSCS, which again puts her in the high risk category case, or if the baby has certain abnormalities, if the baby has certain genetic disorders or chromosomal abnormalities, that again puts the pregnancy into a high risk pregnancy. Now, we had one case around a year ago in which the lady had a huge fibroid along with the pregnancy inside the uterus. So at the time, she had to undergo LSCS. So at the time of LSCS, we had to remove the fibroid just to get to the baby, because the fibroid was in the way of delivering the baby out. Oh. So we had to cut through the fibroid, get to the baby, then remove the fibroid, and then remove the baby out as well, which is, of course, again, makes it into a high-risk pregnancy case, because the woman can undergo a lot of bleeding, or we call it PPH, which again is a risk factor. And hence you have to be extremely careful in these cases. So it's important that you visit your OBGYN or obstetrician gynecologist, help them identify. They will identify the cause or what is the cause of the high-risk pregnancy. And such cases require closer monitoring. They require an individualized approach so that the roadmap can be laid out right at the beginning, and all the challenges can be identified and all the problems can be anticipated. And preparation can be done accordingly, so that there are no last minute challenges or issues which are to be faced.
Right. And you mentioned that certain conditions that develop during pregnancy, like you said, there was diabetes and hypertension. So once the pregnancy is done, do these conditions go back? Like, does the diabetes go back?
Yeah, I mean, definitely in some cases, most of the cases, it would revert back. Even thyroid or even hypertension, which we call it pregnancy-induced hypertension, PIH, or in some cases, it may even go to eclampsia. But anyway, it does go back. So usually we call it the puerperial window. So a 40-day window. So we retest the diabetes or the thyroid, or we retake the blood pressure after 40 days of pregnancy to see whether it has reverted back to normal or not. If not, then we have to manage accordingly. If it has reverted back, well and good.
And are there chances that the baby might also have diabetes when they're born?
No, the baby may not have diabetes, but the baby has its own set of challenges. Now, in a case of a diabetic pregnancy, the babies are usually higher in weight. They require more frequent feeding. So these are the challenges that you have to keep in mind when you are dealing with a diabetic pregnant patient. And thyroid, in all thyroid patients, when they deliver, we do send the thyroid of the baby as well to ensure that the thyroid is normal. And of course, the pediatrician will then take it from there and assess, keep a close watch.
I've heard that there is something known as painless delivery, but I'm not sure how true that is. Mm-hmm. So could you shed some light on that?
Right, so painless delivery is definitely, that's not a myth. And what does it encompass? It's basically giving epidural analgesia at the time of labor to the patient. So it does have its own set of advantages, but it also has its own set of disadvantages. So having a complete understanding of the whole process of painless delivery is very important. And counseling the patient prior to undergoing this procedure is very important, because the patient has to know the pros and the cons of it. And in our own practice, we do, of course, give them the option, but according to us, a lesser percentage of women choose this procedure. So I'll just run through what are the advantages and the disadvantages. When you give epidural analgesia during labor, it causes less pain. That is the whole goal of it.
Correct.
To make sure that the woman has a painless or pain-free delivery. So that is the most important advantage. It also causes less stress to the mother. Less stress to the mother will, of course, ensure that the lady has more freedom of movement, and she does not undergo any other complications like raised blood pressure, or that there is a decrease in the heartbeat of the child, etc. Also, it gives them more flexibility, greater range of movement, so they'll be able to have more flexibility while undergoing the labor process. And of course, it also gives an advantage that suppose if certain emergency procedures have to be undertaken, like an LSES or something, then the epidural analgesia is already given. It reduces the time for the emergency procedure to be taken up. But also it comes with certain set of disadvantages. Now, most important is there's this loss of this pushing sensation, which is there. That is the most important sensation that the woman has while undergoing labor pain, which forces the baby to come out. Now, certain women see it as a disadvantage that there is loss of this pushing sensation. Certain women also experience drop in blood pressure because of this, can suffer from it. And also there may be some numbness. So it is not a myth. Painless delivery does exist, but understanding the pros and cons surrounding it is very important before undergoing this procedure. We cannot just dive into it and then say, oh no, I'm not feeling any pain anymore, I can't push anymore. So all these have to be explained in detail to the patient before she chooses it.
Correct. So like you said, there's no pushing sensation. So when the woman is undergoing labor and if she's not able to push the baby out by herself, is there something that the doctors can do?
Yeah, of course, we can help. There are certain things like vacuum or forceps, but or probably LSES at the most. But it's not that we are advocating the vacuum or the forceps or the LSES. We want a normal delivery. But if there is risk to the health of the mother or to the baby, then these emergency procedures have to be undertaken if the right conditions exist. You cannot just apply forceps or vacuum or willy-nilly to any patient at any stage of labor. It has to be carefully calculated and only then gone ahead with.
All right. So in your practice, personally, do you experience more cases of painless delivery or is it normal delivery that people seem to opt for?
So that's a good question. As I said, I would say that only 25% of the patients would, go ahead with this option of painless delivery, whereas 75% of the patients choose not to go ahead with it. After, of course, hearing the pros and cons of it. And of course, they have to make a decision on their own.
All right. And you mentioned that when we talk about painless delivery, there's something known as epidural that you give to the patients, right? So once the effect of that wears out, is there pain that the mother experiences after that?
It's just like a normal delivery pain without the epidural that the patient may experience post removal of the epidural. But you can give top-up epidural analgesia even after the delivery so that the woman remains pain-free. We of course do give analgesics as well post-delivery, not only if you have opted for painless delivery, but even non-painless deliveries as well. I wouldn't say the pain post-delivery is too much different. But yes, of course, if you do undergo painless delivery, then lesser degree of pain would be experienced.
Okay. We've spoken about egg freezing, we've spoken about sperm freezing, and we've talked about a lot today. And I have this final question in my head that we were able to sit and discuss this today here, but there's still a lot of stigma around conversations like this. Mm-hmm. So in your opinion, what is something that people can do to normalize these topics?
Okay, that's a good question again. To normalize this, we need to have a multifaceted approach. This includes education and awareness. There has to be public campaigns which educate people regarding fertility issues which they can face or are facing. Secondly, there can also be school programs or college programs which can also educate and disperse knowledge regarding such issues. Secondly, we can also have open discussions, not only on social media, but also in-person support groups. So in-person support groups can, give you one-on-one interactions with so many people who are undergoing or who had undergone such issues, which can help you gain knowledge regarding the same. And the same, of course, is also prevalent on social media. Good websites having open discussions, clear and discussions with facts behind them, or even personal accounts can also help you with the same. Now, here also comes the role of healthcare providers. Healthcare providers have to undergo regular training so that they are updated with the latest issues which are arising surrounding fertility or other OBGYN issues. And this training can also be then imparted to women when they come for regular checkups, like we had discussed in counseling, etc. Right. And this also helps to raise awareness, where women can bring up the issues that they are facing and we can then impart knowledge or discuss openly with them. Besides that, even media representation. Nowadays, I've seen a couple of serials in which also they were talking about infertility or IVF treatments. So it is becoming a part of normal pop culture or regular culture as well. And most importantly, also, we can also have an open conversation in the workplace. Suppose if you are, or if your work colleague is suffering from it, he or she can talk to you about it. So normalizing this would help in normalizing the conversation regarding fertility and fertility issues. So having this combined, multifaceted approach and attacking the issue from all sides. Most important thing is talking about it gives us knowledge, empowers us, and that knowledge can reduce the stigma which is there around fertility issues.
Right. I think it's been a very insightful conversation with you today. Is there a final closing message that you would like to give the people viewing you?
My only closing message would be, do visit your gynecologist regularly, maybe once a year. You don't have to go and only meet him or her when you have, certain menstrual issues or any other issues. Don't wait for the issue to occur. Make sure that you catch any issue before it becomes into a major complication. Right. As we have discussed, prevention is better than cure. And that is the key take-home message. Because in India, women, even our mothers, sisters, they tend to neglect their own health. And that is something that I would like to dispel. I would like to make sure that that goes away. Taking care of the health of women is very important in today's day and age. You ensure that the entire family remains healthy, because women are not only taking care of their own work, they're also taking care of families. And our motto is for womenhood and beyond. So not only for womenhood who come to us, but also for their entire family. Hence, please, women of all ages should regularly visit their gynecologist for a regular health checkup. That's my take-home message.
Okay. Thank you, doctor.
Pleasure.